morning. Today I'm going to talk about our study characterizing the learning curve of a virtual intracorporeal suturing simulator, VBLAST-SS. It is known that in order to attain the necessary skills of minimally invasive surgery, trainees must undergo extensive practice prior to performing procedures in the OR, and practice on the FLS trainer box was proven to be effective. However, it requires a large number of consumables, and the performance assessment requires expert evaluation and manual measurement, which are subjective and not immediate. So compared to the FLS trainer box, VR simulators can provide unlimited practice without using consumables, and it can also provide instant and objective feedback. Studies have shown that training in VR is effective, and training in VR is effective, and the skill they acquired in VR can be transferred to both the animated and the human operating room. The VBLAST simulator simulates the 5 tasks in the FLS program. In this study, we focused on the intracorporeal suturing task. The objective of our study is to evaluate the training effectiveness of the VBLAST suturing simulator on intracorporeal suturing skill training, and to assess whether the skills are retained after 2 weeks without training, and constructing the Q-sum learning curves for participants' performance on both systems. We used the standard intracorporeal suturing task as our training task. Then we calculated their performance score based by subtracting the penalty score from the timing score. In this study, we had 14 participants. All of them are medical students and novices in intracorporeal suturing task. They were randomized into 2 training groups, VBLAST group and the FLS group. At their first session, they watched a video instruction of the intracorporeal suturing task, and then they were asked to perform the task on both systems as a measurement of their baseline performance. Then the participants trained on their assigned systems for maximum 30 minutes or 10 trials a day, 5 days a week for 3 consecutive weeks. At the training day 15, their last repetition of the performance was used to determine their post-training performance. And after 2 weeks, participants came back and performed the task on both systems again, and as an assessment of their skill retention. We used the 2-way mixed factorial ANOVA to analyze the effect of group, time point, and their interaction on the performance. Then we constructed the Q-sum learning curves for each participant and analyzed their performance over time. So the ANOVA results showed that within their assigned training systems, there are significantly difference between time points. However, the effect of group and the group time interaction were not significant. Within their assigned training systems, there are significant difference between baseline and post-test, but there's no significant difference between post-test and retention. This result showed that the participants acquired the suturing skill after training, and the skill that they acquired retained after the 2-week retention period. So most of our participants reached the predefined proficiency level and retained their skill after 2 weeks. The cumulative summation is a criterion-based evaluation of the learning process. It can analyze the performance over time with a set criteria. The criterion score was calculated based on previous studies, and in the performance calculation, when participants' performance score is lower than the criterion score, it was considered as failure, and the variable 1 minus S was added to the previous Q-sum score. When participants' performance score is equal or better than the criterion score, it was considered as success, and the variable S was subtracted from the previous Q-sum score. So in the Q-sum graph, a negative trend indicates success, and a positive trend indicates failure. The Q-sum learning curves was generated for each participant. These are the learning curves for the FLS group. In this group, 6 out of 7 participants demonstrated the transition point, which is where the trend of the Q-sum line changed from positive to negative. This indicates a tendency of reach the 5% failure rate with further training. One participant in this group achieved the 5% failure rate at trial 88. It's similar in the VBLAST group. 6 out of 7 participants demonstrated a transition point, and 1 participant achieved the 5% failure rate at trial 117. So in our study, for participants in the FLS group, they went through average 68 repetitions to reach proficiency, and for participants in the VBLAST group, they went through average 54 repetitions to reach proficiency. These results are similar to the previous results of intracorporeal suturing skill training, but because the tasks and the schedules in those studies are slightly different, we cannot compare them directly, but we observed that the slope of learning in those studies are similar. So in conclusion, the participants' performance of intracorporeal suturing increased significantly after training on both systems, and the skill acquired on both systems was retained after a 2-week retention period. And we can conclude that the VBLAST suturing simulator is effective in training laparoscopic suturing skill. Thank you. I'd like to take any questions.